Say anxiety among our kids is at an all-time high and schools are pleading for help.
Research shows about half of American kids with mental health issues do not get treatment. Tonight, the I-Team's Paula Vasan takes us to the Jefferson R7 school district in Jefferson County, where school leaders say there is a solution, but the state needs more money to do it effectively.
The shooting in Uvalde, Texas,
having no regard for human life,
by an 18-year-old who gunned down students and teachers inside his former elementary school.
Something has to be done.
Ignited a fire within Steve Horn.
Absolutely.
To make mental health resources at school a priority.
It's certainly an area that we pinpointed that and said, yes, we have to do better than this.
Especially as he's seen an increase in deaths he believes could have been prevented.
The increase that we saw across the county happened a lot in 2018, 2019. There was an increase in school-age suicides in our county.
The youngest at the time, under 15 years old. Over the years, he's seen kids as young as 11 struggle with thoughts of suicide.
We've seen a great increase in anxiety, depression.
This tool,
it identifies the most appropriate services based on their level of need.
Has been years in the making. It's part of a new pilot program, thanks to about $700,000 in local, state, and federal grants secured by Jefferson County's health department. In the fall, it could be available to around 13,000 students.
Based on their answers, the system applies a risk level to them. And it first and foremost, it identifies any school-based services that are available to them.
What the school realized, about 1 in 5 high school students have thought about suicide. Administrators here wanted to intervene earlier. The result, a resource they say is revolutionizing how they identify when students need help.
Students like 9-year-old Nora Mativa.
Hi, Nora. Hi.
Chelsea Koenig is her therapist. She sees her for an hour at school each week.
What does Miss Chelsea mean to you?
A good friend.
Helping Nora navigate life with autism. Social interaction is a struggle.
Thank you for sharing that with me.
It can make her anxious. Her school therapist teaches coping skills.
This one's cool.
Research shows the national average wait time for a behavioral health therapist is 48 days.
To move them around.
Nora was paired in less than a week. Therapists on campus,
good job,
have meant less red tape and quicker care.
What do you think every school would benefit by having something like this?
I think they would see a big decline in serious matters like suicide, a decline in depression and anxiety. It's so much fun.
Koenig says one of her biggest obstacles is stigma, not among kids, but their parents.
They're scared. They don't want their kids to be judged by anybody, but it's all confidential.
The other major obstacle is funding.
I would love to see the governor then create a line item in the state budget to assist schools in providing school-based mental health services for their students.
The governor's office declined our interview request. Officials with the Missouri Department of Elementary and Secondary Education say it's up to schools to figure out how they want to divvy up resources available to them and prioritize mental health. But many school leaders say that's the problem because it forces schools to choose between their educational and mental health needs. Back to you.